Well, in this series of videos we want to be considering the eye, and the best way to learn something in anatomy is to draw it. Not really any substitute for that. And the eye is a bit of a complex diagram, so as you see I've cheated slightly here. Now the optic nerve is going to be coming in from the back here. So here we have the optic nerve approaching the back of the eye. And there's going to be a tough fibrous layer around the outside of the whole eye here. And this continues to line the optic nerve. This is the outer layer of the eye. This is the sclera. So that's going to go all the way around here. It is a bit long-winded, this method, but if you draw one with me, then you'll learn it much better than any other way. Now this is coming to nearly the front, like this. Let's get it the right way up again. So here we are here. So the eyeball is fairly spherical on this bit, and then what happens is it bulges out a bit at the front like this. But this frontal bulge is completely continuous with the sclera. And this bit at the front is the cornea, which of course is clear. Now don't worry too much about the names just now, we will be putting the labels on. Then there's another layer just here, the second layer, and this second layer is the vascular layer, the choroid, and again it goes all the way around. This is the choroid layer, the vascular layer, and just here it broadens out a bit like this, and then it continues on down here. And we'll see that this structure is the iris. So it broadens out into this ciliary area. And then we have the iris. So what we're seeing is that the sclera is in two parts. This sclera around here and this cornea at the front, the clear part at the front. Now we can actually draw a division there to make that clearer, but it's actually continuous, it's just that this bit is opaque and that this bit is transparent to let the light through. And we notice that the choroid layer is in three parts. There's the choroid here, then this is the ciliary area here, and then this is the iris. So the sclera is this outside layer going all the way around the outside. That is the sclera. Fibrous tissue. And then the vascular layer is the choroid. I think I might just colour these in a bit actually. So the choroid, we said it's the vascular layer, so we'll colour that in red. This is the choroid. This widened bit at the end is the ciliary body, where it widens out at the end. Just here. So this bit, this area here is the ciliary body. And again, we could divide this off, although it's somewhat of an artificial division, but this is the ciliary. So this is the ciliary area here, the ciliary body, and that contains the ciliary muscles. Now just bear with me on the anatomy at the moment, because we will be looking at the physiology in the next clip. And again, here we have the choroid, this choroid layer. taking blood supply to most of the eyeball. Then broadening out in this ciliary area here, and then continuing as the iris. And again, we could sort of divide that off. It's a bit artificial, but so the ciliary, again, the ciliary body and muscle would be there, that bit there. And the iris, this bit here, the iris is the coloured part of the eye. So that is the iris there and there. Looking at it from the front, that is the coloured part of the eye that we see just there, the iris. Now, the lens of the eye, which does a lot of the focusing and accommodation, that is a biconcave disc. And it's just there. So this part is the lens. And of course the lens is transparent to allow light through. So just to clarify, the transparent bits I'm going to colour in yellow. So this front bit is the cornea. That's the cornea there, the front bit. So the cornea is the anterior part of the fibrous layer. The sclera is this big bit at the back, and the cornea is the bit at the front. I have to go colour the rest of the sclera in as well. We'll colour that in blue. This is the fibrous tissue here, covering the optic nerve. And this bit gives a lot of the structural support to the eyeball because it's fibrous, tough tissue. As I've said, it is completely continuous with the cornea. It's just that the cornea is transparent, whereas this bit is opaque. And if we're looking at the front of the eye here and here, this would be the white of the eye. We would see as the white of the eye. So the clear cornea, then the white of the eye there, and the white of the eye there. This back part we don't see because it's in the bony orbit. Now the lens is supported by suspensory ligaments here. And these suspensory ligaments are attached to the lens and to the ciliary body, because remember we said in here there are muscles. The ciliary muscles are in the ciliary body. That contains the ciliary body and muscles. So this bit here is the lens. And again, because it's clear, we'll just draw that in yellow, I think. Because that's the clear portion. Because the light has to go through there. But of course, the reason that we want the light to go through is to get to the photosensitive or the light sensitive area. So the optic nerve is going to come out here, and that's going to continue as neurological tissue around the inside. There's actually an indentation about here in that tissue, and it carries on round to there. And again on this side, the optic nerve comes down, and we have the retina just here. And that is the retina. And the retina is the photosensitive layer. I think I'll maybe draw that in green. So here we have the retina. So this is the optic nerve here. Going down through the optic nerve, down here, in this track down through there, we have the central retinal vein and retinal artery taking blood to the retina. But for now, let's just draw the retina in. So optic nerve there in green. Then the retina carries on here in green. The visual part of the retina. Oh, yeah. So that's the retina. Just there. The retina. Lens. Iris. Now, in between the iris, I think you can probably see there's a gap because the iris expands and contracts, as we'll see in more detail later. And that gap there, this gap here, is the dark coloured, when you look at it, dark coloured pupil. So the pupil is the gap in the middle of this iris diaphragm. Now, there's chambers in the eye. There's a large back chamber here, which I'm going to draw in light blue. There's a large chamber at the back. And this is the vitreous body. Takes up most of the back of the eye. So all of this middle part is the vitreous body. The vitreous body. There we are. Sometimes called the postremal area is the vitreous. And this is gelatinous type material. And this gelatinous type material forms when you're a fetus and you keep it all your life. But again, because it's the retina at the back that is the photosensitive area, and the light's got to go through, then the vitreous has to be, again, transparent to let the light through to the retina. And the retina actually continues. I've drawn the retina finishing there, but the retina actually continues round the ciliary body and the rear surface of the iris there. So this is the continuation of the retina. But this bit is not photosensitive. So this bit here is the non-visual retina. So the visual retina goes up to about here. It's light sensitive, and then but it continues on as the non-visual retina around there. Now, there's a fluid that's produced by the ciliary body, and this fluid goes into this area here, behind the iris. So this way the diagram is a little bit complicated, so we'll be precise. So the posterior chamber is this area here. This area just here is the posterior chamber. Just there. And that contains a substance called aqueous humour. Humour means liquid. So this aqueous humour is going to be produced by the ciliary body. It's a plasma-like substance, but lower in protein, because if it had too much protein in it, it would interfere with the transmission of light, so it's plasma-like. And this aqueous humour Remember, the vitreous at the back, the aqueous at the front. This goes round here, and it gets into this front part here as well. It's transparent, of course. So this is aqueous humour here. And this bit here is the anterior chamber. So let's be clear about that. The posterior chamber is just here, behind the iris. The aqueous humour is produced from the ciliary body, goes into the posterior chamber. Then it comes out through the pupil into the anterior chamber. It's the same fluid, but it's in that chamber there. And then there's kind of a lymphatic vessel here at the junction between the sclera and the clear bit at the front, the cornea. There's a junction there. That's called the scleral venous sinus. So again, let's be precise. This is the scleral venous sinus here and here at the front of the eye. Here and here. It's a circle that goes all the way around. In the old days, the scleral venous sinus used to be called the canal of Schlemm. And actually, although it's called a venous sinus, it's more of a lymphatic really. But what actually happens is the aqueous humour is reabsorbed into the scleral venous sinus, and from there it does drain into a proper vein, so there's this constant circulation. And we'll see in the next clip what happens when that goes wrong. Now, these ligaments supporting the lens from between the ciliary body with the ciliary muscles and the lens, these are called the suspensory ligaments. So again, to be precise, these are the suspensory ligaments here, and they're made up of what's called the zonular fibres. So they are the suspensory ligaments because they are suspending the lens. Suspensory ligaments, zonular fibres. Now, in this area here at the back of the eye, there's a high density of the photosensitive cells called the cones for colour vision, this area here. And in the very centre of this, it's called the yellow spot. It's not that yellow, it's just a tiny bit yellow really. Macula lutea is that area here, the yellow spot, very high in cone cells for colour vision. But the very highest concentration is in that little indentation there. And to be precise, that little indentation there is the fovea centralis. So that is the fovea centralis just there. Part of the visual retina. But as we've said, the non-visual retina goes on to line the ciliary body and the inside of the iris. So this is non-visual retina, just there. And at the back, as we've said, we have the optic nerve. Much more on that later on. Fascinating course of the optic nerve. Taking the electrical impulses with the visual information away towards the brain, but as we've said, at the same time containing the central retinal artery, taking the blood supply to the retina, to the retinal arteries. And you can see these with an ophthalmoscope, they're quite beautiful to look at. And the veins draining away as well, the optic nerve. And then at the front of the eye, we have another layer called the conjunctiva. Now the conjunctiva, we'll start here. The thin layer that goes over the front of the eye. In this bit here. And this bit is the white of the eye, and it's the same on this side. So it goes over the white of the eye. And then it folds back. It folds back on itself like this. And where it folds back is inside the eyelids. Here we have the eyelid with the eyelashes here. This eye is almost closed, isn't it? So this would be the eyelid. This would be another eyelid here. Of course, they're in much closer proximity to the front of the eye. And the front of the cornea here, although it's not technically conjunctiva, it forms part of what's called the conjunctival sac. So here you can see we have a whole area now. We have the conjunctiva arising here. The conjunctiva carries on. This is all conjunctiva lining the eyelids. So we have a conjunctival sac. So when people get things in their eyes, often they get caught up here or here, but they don't go around the back because they can't get past the conjunctival sac. So there we have some of the main components. Sclera, the fibrous layer. Choroid there in red, the vascular layer. Fovea centralis, yellow spot. Retina, the visual retina and the non-visual retina. Posterior vitreous chamber, optic nerve. Ciliary body and ciliary muscles here. Non-visual retina carrying on around here. Aqueous humour produced in the posterior chamber here and circulating through to the anterior chamber. That's the anterior chamber. That's the posterior chamber just there and there. That can go in there. Cornea, the clear area at the front. Suspensory ligaments here and here, holding the lens in place between the ciliary bodies. Pupils, the little gap at the front between the bits of the iris. Scleral venous sinus, draining away the aqueous humour. Conjunctiva, this layer lining the white of the eye. The lens, that clear bit there to focus the light, and the iris, that coloured part at the front of the eye. So that's a look at the anatomical structures. You have to learn these if you're going to understand the functions of the eye. That's the basic anatomy to start with. And as I say, no substitute for drawing your own pictures. And in the next clip, we'll look at the physiological function of these components. Now here's the diagram of the eye we've just developed in the previous clip. And I'm aware that the anatomy here is somewhat complicated, so I want to try and systematize it somewhat. So when we're talking about eye anatomy, the structures in the eye, we can divide this into two sections really. There's the internals and the externals, or the layers. So first of all, internals. What are the internal structures? Well, we know about the lens to facilitate accommodation. And then behind that we have the large vitreous body. The large vitreous body in that area we called the postremal chamber. Postremal not posterior chamber, because the posterior chamber is something different. There's the posterior chamber and the anterior chamber. And just to remind ourselves in the diagram we've been using, the vitreous in the post-remal chamber is this large area here inside the blue line. This is the lens in yellow. Now the anterior and posterior talk about being in front and behind of the iris. So this is the iris, so the posterior chamber is here and the anterior chamber is here, but we notice that they're both filled with the aqueous humour. So they're internal structures. Now next we come to the layers in the eye. And the outer layer is fibrous. The fibrous layer, sometimes the layers are called tunics. Tunic just means coat or layer. So the fibrous layer consists of the sclera and the cornea. And external to the sclera we have the conjunctiva. External to the sclera, also lining the inside of the eyelids. So these are all part of the fibrous layer, and we can see that on this diagram. So we're thinking about the sclera, the outside, in blue, the outside fibrous layer. But it's continuous with the cornea. It's just that the cornea is transparent. So we include it in this section. And between the sclera and the cornea, there is the scleral venous sinus, also called the canal of Schlemm. After the German anatomist Fred Schlemm, fascinating character, was once arrested for cutting a body up in a graveyard. But he did this original work back in the 1830s and he discovered this scleral venous sinus. It's called venous, but it's more of a lymphatic really, to drain away the excessive aqueous humour. So that we have that fibrous layer. Now the next layer is vascular. The vascular layer. A lot of the blood vessels go through this layer. And we have the choroid. We have the ciliary body. And also included in this is the iris. So as you see here, this layer is in red because it's vascular. So here we have this layer. This is the choroid around here. But it's continuous with the ciliary body, which is continuous with the iris. So it's all one vascular layer in red on this original diagram that hopefully you've built up already. So, layers, fibrous, vascular. The last one is the retina. Now the retina. Now the retina has an outer pigmented area, which is dark in colour, because we don't want light rays bouncing around inside. We don't want them reflecting inside the eyeball, because that could generate additional false images. And it would make vision very glary if that were the case. So there's an outer pigmented layer, and that is immediately on top of the choroid, the vascular layer. But then on top of the pigmented layer, we have the neural layer of the retina. The neural layer. As the name suggests, it's neural tissue. So here we see the neural tissue in green, and we have the retina here. And we notice the retina goes round, and it also goes behind the ciliary body and behind the iris. And actually both layers of the retina, the outer pigmented and the neural layer, do go around that whole area. But we can subdivide the neural layer into the visual retina, sometimes called the optical retina. That contains the rod and the cone cells that actually generate the vision. And we can have a non-visual layer as well. It's still neural, but it's non-visual. Now what happens actually is the pigmented layer is all the way around. It's the basal layer of this green bit. And it goes forward to line the inside of the ciliary bodies in the iris. And actually there's a very thin layer of neural tissue actually on top of this anterior part of the retina here. But the larger area of the retina from here backwards is the visual retina. So this area in the visual retina is light sensitive, whereas the very thin layer of neural tissue in the anterior retina is not light sensitive. So what we see is we can divide the eye up into these areas. So we have the internals, that's around here, the internals, and we could divide off this area here as well if we wanted to as a subsection. The area in front of the lens, the posterior and the anterior chamber in front of the lens, with the posterior chamber being behind the iris and the anterior chamber being in front of the iris. Then we have the fibrous layer, sclera and cornea, with the conjunctiva external to the sclera and lining the eyelids. Then we have the vascular layer, consisting of the choroid, the ciliary body and the iris. Again, a continuous layer, but with these different components. And then we have the retina, the inner layer, and the retina consisting of an outer pigmented layer and an inner neural layer. And again, if we wanted to, we could divide the neural layer into the visual and the non-visual areas. So a kind of mind map of the anatomy in the retina, in the whole eyeball rather. The retina, the vascular, the fibrous and the internals. Now in this video we want to think about the physiology of the eye, what's going on. Well, the eyeball is about 2.5 centimetres in diameter, but only the front 1/6 or so is exposed. So if you think about it, that bit there in the front is exposed, because these are the eyelids here. This bit at the back is all in the bony orbit. So the orbit is the hole in the skull, if you like, formed by the bones of the orbital cavity, and most of the eye is protected in there. And that's very important for protection, because if we get a blow to the front, hopefully it will hit the ridges of the orbit and won't damage the eye itself. The anterior part of the eye is in front of the lens, so that's the lens there, and the posterior part is behind the lens. So about 4/5 of the eye is actually behind the lens. Again, a relatively small part that we see at the front. And there's also extrinsic eye muscles. So the eye's got 6 extrinsic muscles. They're largely attached to the sclera. So the 6 muscles, for example, we could have the superior rectus muscles and the inferior rectus muscles. And these are very important because they allow us to move the eye so we can see, look in different directions. Now the aqueous humour, as you might remember, the aqueous humour is produced in the posterior chamber. So remember, that's the posterior chamber there, not the vitreous chamber. That's the anterior chamber. So the aqueous humour is produced in the posterior chamber, and from there it goes through the pupil. So that's the pupil there. The gap in the iris is the pupil. So it goes through the pupil into the anterior chamber. It goes into the anterior chamber. And it nourishes the avascular cornea and lens. Now the cornea and the lens obviously need to be transparent, so the light can go through. But that means they don't have a blood supply. So if they don't have a blood supply, they still need oxygenated, they still need nutrients, they still need to get rid of their waste products. So it's the aqueous humour that nourishes the avascular cornea and lens. The lens and the cornea are avascular, they do not have blood vessels. And the aqueous humour is absorbed into the scleral venous sinus, which is about there, just between the cornea and the sclera, what used to be called the canal of Schlemm. So that's reabsorbed. Now there's an imbalance in the production or reabsorption of the aqueous humour that can lead to raised intraocular pressure. So all the time the aqueous humour is being produced, circulating through the pupil and being reabsorbed. That's the normal situation. It's always being produced and it's always being reabsorbed. But if we think about it, if too much is produced or not enough is reabsorbed, then that can lead to an increase in pressure in the eye. This is called intraocular pressure. There can be an increase in the intraocular pressure. So if you've ever been to the opticians, you probably remember that they blow 3 puffs of air onto your eye to measure the pressure in the anterior chamber. Because if it goes up, that's called glaucoma. And that is a dangerous condition, because if there's increased pressure in the anterior chamber, that will push on the vitreous. And at the back of the vitreous we have the very delicate retina. Very delicate retina and the blood supply in the retina, which can be compromised if there's an increase in intraocular pressure, called glaucoma. Actually quite a common cause of blindness. Now thinking about the lens in yellow there, the lens of the eye, obviously it's transparent, biconcaved, it's an elastic disc. And it's refractive, it bends the light rays. So the light rays will come in and it will bend them to focus them on the retina. Refraction is the bending of the light rays. And this is what provides visual acuity. It gives a sharp focus on the lens. Or the lens gives a sharp focus on the retina. But sometimes the lens becomes cloudy. And that's called cataracts. So cataract is when the lens becomes cloudy. And as you get older, unfortunately, the lens becomes less elastic and it's harder to focus on close objects due to loss of elasticity of the lens, and that condition is called, rather unflatteringly, it's called senile presbyopia. I've developed it, I'm sure you'll develop it. All you've got to do is live into your 40s and you'll develop senile presbyopia. You find it harder to focus on things which are close in, caused by loss of elasticity in the lens. Now here we have the vitreous, or the post-remal chamber, this large chamber behind here. And the vitreous body is transparent and it's gelatinous. It's obviously got to be transparent because the light rays need to get from the lens through to the retina, so it needs to be transparent. It's produced as a fetus, and after that it's not replaced. You have the vitreous gelatinous substance for life. Now we know that the outer layer is the sclera, in blue the fibrous layer, the sclera. And this is an opaque layer, it's dense connective tissue, so it's very tough material. And the white of the eye is seen through the front conjunctival covering of the sclera. So just there we have the white of the eye. So if you think about an eye, it's kind of, the eye's this shape roughly. There's an eye. And we have the coloured part and the pupil. This is the dark pupil in the middle. The iris around the outside. The white of the eye is here. And that is the sclera that you're looking at there, albeit covered with conjunctiva. So the sclera at the front there is white. Now at the back it's pierced by blood vessels, and of course we have the optic nerve going in here. But there's also blood vessels that pierce the sclera, because we need the blood vessels to go through the outer sclera in order to get to the vascular layer, in order to get to the choroid. And as we've said, it's also an attachment for the extrinsic eye muscles. And the sclera itself is covered by a fascial sheath of the eyeball. Now the cornea is simply a continuation of this layer, but of course it's transparent, covering the front sixth of the eyeball. Now if corneas are damaged and scarred, they can sometimes be replaced by a corneal transplant. And because there's not a blood supply to the cornea, eye surgeons can transplant a cornea from a donated eye, and we don't have as many problems of rejection because it doesn't have a blood supply. But the cornea can be easily damaged and scarred, so we have to take care of it. So for example, sometimes we put in local anaesthetic drops to anaesthetise the front of the eye. But that's good to take things out of the eye if there's foreign bodies, for example. We can put in lignocaine eye drops. But the trouble is that means the patient can't feel anything. So if they get any grit, suppose there's a piece of grit in there, that can scrape the front of the cornea, causing corneal scarring. That's why if we put local anaesthetic in an eye, we'll always close the eye and put an eye patch on until the local anaesthetic's got time to wear off. Now, as we've said, the conjunctiva, that's the cornea, that bit there. The conjunctiva is this layer of clear tissue lining the sclera, the white of the eye, and lining the inside of the eyelids. And this forms the conjunctival sac where the tears and the fluid of the eye are. But it's quite common for that to become infected by bacterial infection. And if that happens, that's called conjunctivitis. So conjunctivitis is inflammation. Itis means inflammation of the conjunctival sac. Now the middle layer of the eye is the choroid, the vascular layer in red. The choroid there, extending round to the ciliary body and muscles just here, and the iris just there. And looking at it from the front, the iris is the coloured part of the eye. So if you have blue eyes, that will be blue. That is the coloured part of the eye, the iris. So you're seeing there from the front, of course. Here we're seeing it in section. Now the choroid at the back is vascular. The blood vessels pass through, so the blood vessels pass through the external sclera into the choroid and then forward to give a blood supply to the eye. It also contains some melanocytes which produce melanin. It's pigmented. And the choroid is firmly attached to the retina, or to the lower layer of the retina, the pigmented layer of the retina. But it's loosely attached to the sclera, the outer layer. So it's well attached to the retina, but only loosely attached to the sclera. Now, because it contains melanocytes, unfortunately these melanocytes can become malignant, and there can be a condition called melanoma if there's a lot of exposure to ultraviolet light. So there's actually melanocytes in the choroid and in the basal layer of the retina. They both contain melanocytes. That's why if these melanocytes can become, or they sometimes become malignant, there can be a malignant melanoma causing a tumour within the eye. Now, we see here we have the ciliary body and the ciliary muscles, and these are absolutely essential for the process of accommodation, because it's contraction and relaxation of the ciliary muscles that control the thickness or the thinness of the lens, giving the eye its ability to vary its focus to make sure we have good visual acuity, so the light rays are accurately focused on the visual retina to produce an image. So in the next clip we'll look at the activity of the ciliary body in facilitating this process of accommodation. So in this clip we're thinking about focusing. How does the eye ensure that the image that is formed in the retina is in sharp focus? Well, we have the cornea at the front, as we know, and then we have the lens. Now actually 75% of the refraction of the light rays that goes into the eye is achieved by the cornea. Now what we mean by this refraction is that the light rays will come in, but then they need to be bent through a particular angle to focus them on the retina. And that angle through which the light rays are bent is the refraction. So about 75% of the refraction will take place in the cornea, the other 25% in the lens, which doesn't sound like a lot, but the thing is, the lens is the bit that is flexible. The refractive index of the cornea is constant. So we need the ciliary body and muscles, which are just here. And the lens is suspended by these suspensory ligaments made up of the zonular fibres. Now, to see what's happening, we need to look at this from the front. So if we're viewing this from the front, if we're viewing this in this direction here, then what we actually have is there is a ring of ciliary muscles comprising the ciliary body. So this is a complete ring, because remember the eyeball is spherical. So there's a ring there. And the size of this ciliary ring can vary because the muscles can contract and they can relax. And the lens is going to be in the middle here. So this is the ciliary ring here, ciliary body. The lens is in there, and we have the suspensory fibres holding the lens, the suspensory fibres holding the lens in this ring of ciliary muscles. So what we've drawn there in red is the suspensory ligaments, the zonular fibres. So that's looking at it from the front. Now for the process of accommodation, the ciliary muscles can relax and they can contract. Now to look at objects close up, and young adults can look at objects that are only about 10 centimetres away and still focus. This is actually controlled by the nervous system, so impulses come from the oculomotor nerve. And what will happen is, here we have the outside of the ring of ciliary muscles. And to focus on close-up objects, there's going to be contraction of the ciliary muscles. And when the muscles contract, that's going to reduce the size of the gap in the middle. It's going to increase the diameter of this ring here, or the thickness of this ring. It moves in like this. And we had the suspensory ligaments, but because now the ring has moved in, there's less pressure on the suspensory ligaments. So these are now loose. And when the lens can, the elasticity of the lens will make the lens go short and fat. So the lens will go short and fat if it can. So the lens will become shorter, or it will have a less diameter, a more narrow diameter will become thicker. And that's important because when the lens is, if we have like a short fat lens here, like this, and we have a short fat lens, then what will happen when the light rays come in, light rays will be actually refracted at the surfaces of the lens, but when that comes in, it's going to change the angle quite significantly. So it will change the angle. So this angle here is greater when the lens is short and fat. But if the lens is thin, the lens is stretched, still the same volume of lens here, but now it's stretched, so the light will not be refracted as much, the angle of refraction will be less. So short fat lens, high angle of refraction, the light rays are bent a lot. Thin lens, lower angle of refraction, the light rays are not bent as much. So to focus on close objects, the ciliary muscles contract. That relaxes the suspensory ligaments, and when the lens can, it will naturally become short and fat. The elasticity of the lens naturally makes it shorter and fatter, increasing its refractive index. And that's important because light rays from a close object are still going to be diverging, going apart. So they need to be converged more to focus them on the retina. So, short close focusing, contraction of the ciliary muscles. Contraction of the ciliary muscles means the ciliary ring gets broader. That reduces the tension on the suspensory ligaments, so they no longer stretch the lens. So the lens contracts with its own elasticity and becomes shorter and fatter. So this increases the refractive angle. So there's more convergence of light rays for focusing and accommodation. But we also need to focus on distant objects. So for distant focusing, what will happen for distant focusing is that the ciliary muscles will relax. So here we have the same size external ring of ciliary muscles. So remember, this one was near focusing, and this one is distance. Now what happens is the ciliary muscles relax, and when the ciliary muscles relax, the ciliary ring gets shorter, thinner. So contraction of the ciliary muscles makes the ring thicker. Relaxation of the ciliary muscles makes the ring thinner. But of course, the zonular fibres now, because the ciliary muscles have moved out, these are going to be stretched. So the suspensory ligaments are stretched. And of course the lens is in the middle here, connected to these suspensory ligaments. So that means the lens is going to be stretched. And when the lens is stretched, stretching of the lens is going to increase the diameter, so the lens is going to become thinner, like this. That means the light rays are going to be refracted less. Because when light is coming from 6 meters away or more, the light rays are almost parallel. From distant objects, the light rays are essentially parallel. So that means they don't need to be bent as much to focus on the retina. So from close objects, the light rays are still diverging, so they need to be refracted more. So we need the shorter, fatter lens. But for distant objects, we need less refractive angle. Most of it's going to be supplied by the cornea anyway, so the lens, we need less refractive angle. So the lens is going to become thinner because the ciliary muscles have relaxed. So distance vision, the ciliary muscles relax, the ciliary ring becomes thinner, thereby stretching the lens. That reduces the refractive angle of the light passing through the lens. Less refractive angle, so the almost parallel light rays from more distant objects don't need to be refracted as much, and they will also be accurately focused on the retina to give us accurate focused images at a distance. So active ciliary muscle contraction for close focusing, but for distance focusing the ciliary muscles just need to relax, but that stretches the lens. The lens gets bigger because it's thinner, stretched and thinner, so the refractive angle is less. So for moving from close to distant objects, we have the coordinated activity of the ciliary body, the ciliary muscles, the zonular fibres, altering the refractive index of the lens.